Blood cancer, also known as hematologic cancer, is a term used to describe various types of cancer that affect the blood, bone marrow, and lymphatic system. In today's video, All About You Tips will provide a comprehensive overview of blood cancer, detailing its types, symptoms, diagnosis, treatment options, and prevention strategies. First, what is blood cancer? Blood cancer occurs when abnormal blood cells start to grow uncontrollably, interfering with the normal functions of the blood. These cancers generally originate in the bone marrow, where blood cells are produced. The three main types of blood cancer are leukemia, lymphoma, and myeloma. Types of blood cancer. Leukemia. 1. Acute leukemia progresses rapidly, requiring immediate treatment. Acute lymphoblastic leukemia, ALL. Acute myeloid leukemia, AML. 2. Chronic leukemia progresses slowly and may not require immediate treatment. Chronic lymphocytic leukemia, CLL. Chronic myeloid leukemia, CML. Lymphoma. 1. Hodgkin lymphoma, characterized by the presence of Reed-Sternberg cells. 2. Non-Hodgkin lymphoma, NHL, a diverse group of blood cancers that includes many subtypes. Myeloma. 1. Multiple myeloma, cancer of plasma cells, which are a type of white blood cell responsible for producing antibodies. Risk factors. Risk factors for blood cancer vary depending on the type, but may include 1. Genetic factors, family history of blood cancer. 2. Age, risk increases with age. 3. Gender. Some types are more common in specific genders. 4. Previous cancer. Treatment, radiation or chemotherapy for other cancers. 5. Exposure to chemicals, such as benzene. 6. Radiation. Exposure, high levels of radiation exposure. 7. Infections. Certain viral infections like Epstein-Barr virus, EBV, and human immunodeficiency virus, HIV. Symptoms of blood cancer. The symptoms of blood cancer can vary widely depending on the type and stage of the disease. But common symptoms include 1. Fatigue, persistent tiredness and weakness. 2. Fever and chills, frequent or unexplained fevers. 3. Frequent infections, due to a weakened immune system. 4. Unexplained weight loss, significant weight loss without trying. 5. Swollen lymph nodes, particularly in the neck, armpits, or groin. 6. Easy bruising or bleeding, including frequent nosebleeds and heavy menstrual periods. 7. Bone and joint pain, particularly in leukemia and myeloma. 8. Night sweats, excessive sweating during the night. 9. Shortness of breath, due to anemia or other blood abnormalities. Diagnosis. Diagnosing blood cancer involves several steps, including 1. Medical history and physical exam. Initial assessment by a healthcare provider. 2. Blood tests, complete blood count, CBC, to check for abnormal levels of white blood cells, red blood cells, and platelets. 3. Bone marrow, biopsy, extraction of bone marrow tissue for examination under a microscope. 4. Lymph node biopsy, removal of lymph node tissue for analysis. 5. Imaging tests such as X-rays, CT scans, and PET scans to detect tumors or other abnormalities. 6. Cytogenetic analysis examines chromosomes in cells to identify specific genetic changes. 7. Flow cytometry measures the properties of blood cells to detect cancer cells. Treatment options. Treatment for blood cancer depends on the type and stage of the disease, as well as the patient's overall health and preferences. Common treatments include 1. Chemotherapy, use of drugs to kill cancer cells. 1. It can be administered orally or intravenously. 2. Radiation. Therapy, high-energy radiation to destroy cancer cells or shrink tumors. 3. Stem cell transplant, replaces diseased bone marrow with healthy stem cells. Autologous transplant, uses the patient's own stem cells. Allogeneic transplant, uses stem cells from a donor. 4. Targeted therapy, drugs that target specific molecules involved in cancer cell growth. 5. Immunotherapy, enhances the body's immune system to fight cancer. 6. CAR T-cell therapy, genetically modifies the patient's T cells to attack cancer cells. 7. Biological therapy, uses substances made from living organisms to treat cancer. 8. Surgery, rarely used but may be necessary to remove tumors in certain cases. Prevention and early detection. While some risk factors for blood cancer cannot be changed, certain measures can help reduce overall risk and facilitate early detection. 1. Healthy lifestyle. Maintaining a healthy diet, regular exercise, and avoiding tobacco and excessive alcohol. 2. Avoid exposure to chemicals, limiting exposure to known carcinogens like benzene. 3. Regular checkups, especially for individuals with a family history of blood cancer or other risk factors. 4. Early detection, paying attention to symptoms and seeking medical advice for unusual signs. Blood cancer is a complex disease with various types, each requiring specific diagnostic and treatment approaches. Understanding the symptoms and risk factors is essential for early detection and effective treatment. By maintaining a healthy lifestyle, managing risk factors, and staying vigilant about changes in health, individuals can take proactive steps toward preventing and managing blood cancer effectively. If you experience persistent symptoms or have a family history of blood cancer, consult a healthcare professional for appropriate screening and guidance. If you enjoyed this video, please give it a thumbs up and share it with your friends. Don't forget to hit that subscribe button and ring the notification bell so you never miss out on our latest life tips and tricks. Thanks for watching!